The Bureau of Emergency Medical Services of the Pennsylvania Department of Health has implemented a program to bolster the emergency preparedness capabilities of the EMS system. The Strike Team program was established in 2003 by the Bureau with a grant from the Federal Health Resources and Services Administration. This voluntary program involves EMS services from all of Pennsylvania's 16 EMS regions. Each region has teams who have met specific equipment and education requirements that raise their level of emergency preparedness. The objective of the Strike program is to increase the ability of the regional and statewide EMS systems to respond to a catastrophic event within the Commonwealth and in mutual aid areas, and still have the resources in place to meet daily EMS needs. EMS strike teams are dispatched as a resource through the State Emergency Operations Center in coordination with the Pennsylvania Department of Health. The Bureau of EMS coordinates with each EMS regional council to deploy the most appropriate resources and personnel. EMS strike teams responding from the Commonwealth have a cache of supplies and equipment to be self-sufficient for up to 72 hours after deployment. Some of this equipment includes food and water, sleeping gear, and medical supplies and equipment. Our teams are comprised of emergency medical technicians, paramedics, and pre-hospital registered nurses and doctors who volunteer for this program. As an integral part of the EMS strike program, the Bureau will test the teams to ensure they are at a constant state of readiness. Recently, an exercise was held at Fort Indian Town Gap so that all EMS strike teams within the Commonwealth could demonstrate the ability to work within the system of unified command. As a part of this exercise, command and control structure was set up in the same manner as if this was an actual deployment. The deployed teams first report to a staging and check-in post as designated by command. At check-in, each team member's credentials are verified and an ID card is printed. Team members are logged at check-in for personnel accountability and then return to their vehicle to await further instructions. The next stage of the deployment is to proceed to an assigned operational area by command. Upon arrival to the assigned area, a briefing is held with the teams to make the mission's objectives clear and to highlight any safety concerns that will affect personnel. After the briefing, teams set up their equipment and initiate the operational phase of their deployment. Command and control of any deployment works under a system of unified command and adheres to the working structure of the NIMS system. The Bureau of Emergency Medical Services will continue to build upon the solid foundation established by our existing EMS strike teams to further bolster the Commonwealth emergency preparedness capabilities.